Hi, my name is Jen Carroll. I'm a third-year resident at Virginia Tech, and today I'm going to discuss our results from the first inpatient trial of high-intensity focused ultrasound for the treatment of canine solid tumors. Our objectives were to evaluate the safety and feasibility of thermal HIFU for the treatment of canine solid tumors, and to evaluate changes to the intratumoral microenvironment following partial tumor ablation. Patients were considered for inclusion if they had subcutaneous solid tumors larger than 1 centimeter, and they were excluded if they had poor performance scores, received anti-neoplastic therapy within the previous 3 weeks, or impaired liver and kidney function that would prohibit safe anesthesia. Once enrolled, they were staged with thoracic and abdominal CT. Pre-treatment biopsies were performed, and treatment with HIFU to result in partial tumor ablation with Draculion echopulsinate was performed. The tumors were resected 4 to 6 days later, and samples were submitted for histopath, immunohistochemistry, and quantitative RT-PCR. To date, we've successfully treated 20 out of 20 planned dogs, and 18 of which had their tumors treated and resected according to protocol. 2 dogs had their tumors treated and monitored over time. Patients included in the study included a mixture of pure and mixed breed dogs. It was relatively evenly split between males and females, and all but 2 were spayed or castrated. The median age was 10.5 years, and a variety of soft tissue tumors were included, including 15 soft tissue sarcomas, 3 mast cell tumors, 1 osteosarcoma, and 1 thyroid carcinoma. Adverse events related to treatment with HIFU included varying degrees of thermal injury, with 5 patients developing 3rd-degree burns, and fewer developing superficial and deep 2nd-degree burns, and 1 with a 1st-degree burn. 1 patient with a mast cell tumor experienced a degranulation event. This is not surprising given the fact that these tumors often degranulate following trauma, surgical manipulation, or treatment with anti-neoplastic therapy. Other events not directly related to treatment with HIFU included 1 patient developing a grade 4 anemia post-operatively, 1 patient self-mutilating due to poor owner compliance after surgery, and 1 patient with developing wound dehiscence due to infection. Survival times were calculated for the 18 dogs treated according to protocol, and a median survival time was not reached. This is not surprising given the high proportion of patients with low-grade soft tissue sarcomas in this particular study. 3 dogs died within the course of the study period, 2 of which were due to progressive disease, and 1 was believed to be unrelated. Only 1 dog developed local recurrence, and the remainder are doing well to date. Here's just a representative section from one of the tumors submitted for routine hematoxylin and eosin. And what you can see is that there is a discrete ablation zone and a discrete zone of transition between the ablated and untreated tumor, and necrosis appears to be complete. Immunohistochemistry for CD3 revealed a subjective increase in CD3 positive T cells in the zone of transition as well as the ablated tumor. Staining for CD79A was a little bit more questionable due to the heavy background staining. Staining for IBA1 revealed a moderate number of macrophages within the ablation zone as well as the zone of transition, but further analysis needs to be performed to see if they actually represent a true increase. Unfortunately, due to COVID-19 and problems with getting the necessary reagents, we haven't been able to complete all of our gene expression analysis, but quantitative RT-PCR performed for 7 paired samples revealed multiple genes associated with pro-inflammatory cytokine signaling, upregulated greater than 2-fold post-treatment, with only interleukin 18 coming close to reaching statistical significance, but we'll see if this still stands after the remainder of samples are analyzed. So to date, HIFU appears feasible in the canine patient, results in predictable ablation, and relatively safe in the short term, but there are concerns for thermal injury, and it does appear to result in recruitment of immune cells to the periphery of the tumor and tentatively produces a pro-inflammatory environment. I'd like to thank the Focused Ultrasound Foundation and Great and Freelander Fund for funding this study.